increase regeneration and increase focus on statistics. 2014 data projected that employment of medical and health services managers is expected to grow 23% from 2012 to 2022, faster than the average of all related occupation. Due to well-paced advancements in the health sector, development of various allied health fields, and highly qualified specialties and subspecialties, the need for the managerial roles has also increased drastically. So as we are talking about both things, healthcare industry and management, so I will keep talking about both things in tandem. So the learning objectives for today's class are, first of all, this is my style. I do not start my lectures without talking about basic definitions, so that the concepts about the basic terminologies which will be used again and again are clear to everyone in the class. So if a person knows about all of the important definitions, then it is very easy for the person to understand whole concept of the discussion. Then our second objective will be introduction to healthcare industry and its various sectors, segments of a healthcare industry and their importance in modern day health sector, difference between healthcare sector and pharmaceutical sector and other allied healthcare industry in today's world, role of healthcare management in modern day healthcare industry, what does healthcare management involve, and understanding the roles of healthcare manager. Definitions. Health. Health is a state of physical, mental, and social well-being of a person, and not merely the absence of disease or infirmity. And that is very important to understand. What is health? Health is a state of complete physical, mental, and social well-being of a person, and not merely the absence of disease or infirmity. So basically, if a person is disease-free, he should be completely physically, mentally, and socially fit to be called as a healthy individual. If we call some person as healthy, then he should be physically, mentally, and socially fit to be called as a healthy person. And then we come to healthcare. Organized provision of medical care to individuals or a community is called healthcare. The improvement of health via the prevention, diagnosis, and treatment and cure of diseases and illnesses is my phone is just... The improvement of health by the prevention, diagnosis, and treatment and cure of disease, illness, injury, and other physical and mental improvement in people through an organized way using health professionals and allied health fields is healthcare. So if you provide organized healthcare to a community, that is healthcare, in an organized way, in a very thoughtful way, in a very meaningful way, then you are providing healthcare to any community. Then what is an organization? Organization refers to a collection of people who are working together in a systematic way to achieve a predetermined common goal or objective which can't be achieved by any person working alone. So if a group of people or a group of persons start working together in a systematic way, in an organized way to achieve a common goal, to achieve a goal set by them, to achieve a common goal, then that is called an organization. Organization refers to a collection of people who are working together in a systematic way to achieve a predetermined common goal or objective which can't be achieved by any person working alone. And when we talk about organization, as we are talking about our healthcare subject, so we can't move ahead without talking about healthcare industry. So healthcare industry or medical industry is an aggregation and integration of various subsectors within the economic system that provides goods and services to treat patients with curative, preventive, rehabilitative, and palliative care. So our industry, I being a doctor, will talk about our industry. Its main focus is patient. If we are here, we are doing our work, we are providing a service. That service is just because there is a patient which needs my service. So my industry's sole focus, my industry's sole reason to exist is just because there are patients around the world who need our help. Healthcare industry is different from all other service industries, all other sectors, as this is a very sacred job, not only a financial market, not only a easy way to earn money, but it's a sacred duty to help other ailing humans. You are not just earning money, but you are serving the ailing humanity. You are tracking, you are helping the poor, you are helping the needy, you are helping those who are in need, you are helping those people who are afflicted with sickness or some kind of disease that they don't know about. So our industry has very crucial role, as this industry deals with ailing humanity. So our industry works in very aggregated and integrated way uh, of various subsectors. There are various subsectors. We will talk about all of the subsectors of our healthcare industry, which actually work together in tandem to provide goods and services to treat patients. That is the sole purpose of our industry. And then we come to our second part of our lecture or presentation, that is management. So what is management? It has been defined as a process comprised of social and technical functions and activities occurring within an organization for the purpose of accomplishing predetermined objectives through human and other resources. So what is management? It has been defined as a process comprised of social and technical functions and activities occurring within an organization for the purpose of accomplishing predetermined objectives through human and other resources. And then we come towards healthcare management, as we are talking about healthcare industry and management. That is the sole purpose of our class. So healthcare management is the profession or the field that provides leadership and direction to organizations that deliver personal health services to public and to divisions, departments, or units serving within those organizations. So basically, if you start managing healthcare sector, you become the healthcare manager. Management is a broader term. A manager could be a manager at any kind of sector, at any kind of industry. But when you become a healthcare manager, then you start working in healthcare organizations. We already talked about what an organization is. It's a systematic way of a group of people to achieve a common objective. So how to achieve that objective? You need some leaders. So healthcare management is the thing which provides leadership and direction to the organizations that deliver personal health services to public and to divisions, departments, or units serving within those organizations. So healthcare management does not only deal directly with the patients, it also deals with the healthcare providers. The management also deals with the healthcare providers as well. How? We'll talk later. Then manager. Manager is the person who works with and through other people, who works with and through other people, carrying out technical and interpersonal activities to achieve the desired objective of the organization he's working for. This is a broader definition of a manager. A manager could be working in any kind of sector, in any kind of field, not only healthcare sector, but because we are talking about general definition of a manager. So who is a manager? A manager who is the person who works with and through other people, carrying out technical and interpersonal activities to achieve the desired objective of the organization he's working for. Our manager is the person in the organization who supports and is responsible for the workers' performance of one or more other person. So manager is basically a team leader type of person. He not only does his job, but he's responsible for the job of other people as well. He is responsible for the jobs of janitors. He's responsible for the jobs of doctors. He's responsible for the jobs of nurses. He's responsible for the jobs of technicians. He's responsible for the jobs of electricians of the hospital and many other people. So manager has to oversee all of those trades of work and he has to manage the needs of those people. He has to manage the rosters of those people. He has to manage the duty hours of those people as well. Then we come towards our next learning objective, and that is segments of a healthcare industry. So whenever we talk about healthcare industry, the sole focus, as we already discussed, the sole focus of healthcare industry is patient. So first segment of healthcare industry is patient. Patients form the backbone of any healthcare ecosystem as they are the end-level consumers around which all of the healthcare industry revolves. If there is no patient, if there are less patients, there will be very less developed industry. If there are more patients or more number of patients, the healthcare industry will develop at a very rapid rate. US healthcare industry is more than 10% of the GDP of the United States of America. And why? Just because we have developed a very, very good healthcare industry with respect to other regions of the world. Although there may be debates about whether there should be insurance system or there should be hospital funded government funded hospitals, because many people are just tired of insurance systems and insurance companies not giving you what you owe or not giving you proper health coverage, and many people are not happy with the insurance system in the US, but still their hospitals and their healthcare ecosystem is one of the most advanced in the world. So that's why I'm talking about United States of America. And because of their highly advanced healthcare ecosystem, many of the world's wealthiest people also go to America for their advanced treatments. So like in Pakistan, many of the people from our country also move to America or United Kingdom to get some kind of advanced treatment or advanced surgeries that cannot be done here in Pakistan. So I'm just giving an example of my first-hand experience. So people move to America or people move to United Kingdom or Germany as well to get some advanced surgery done, to get some advanced anti-tumor therapy and things like that. So their healthcare ecosystem is developed to this extent that other countries, rich people also go there if they can afford, obviously, to get treatment from these countries. Then the second segment of healthcare industry is healthcare providers, direct care settings. Well, healthcare providers mean hospitals, clinics, and other healthcare setups, whether public or private. Then there are nursing homes and other rehabilitative centers. Then there are ambulatory service providers. Then there are healthcare budgeters. They are also important. Healthcare budgeters are the one who make policies. Healthcare budgeters are the one who decide what kind of treatment and to what extent the treatment can be provided in a specific healthcare organization or in a specific area. Healthcare budgeters are insurance companies and government agencies that provide healthcare coverage and make new policies. So when you talk about healthcare providers and you do not talk about healthcare budgeters, then your talk is incomplete. So whenever you're talking about healthcare providers, then healthcare providers are mostly direct care settings. Then just like nursing homes, hospitals, clinics, or any other healthcare setup, whether it's public or private, all of these healthcare providers, direct care settings are being influenced by healthcare budgeters. For example, if there is a private clinic in a very poor locality, then that private clinic cannot run without any insurance company. I'm talking about a healthcare budgeter. That private clinic, or even in some instances, or in some countries like US or Switzerland, they both have very high insurance company rates. with respect to other developed nations. So even a public healthcare setup or a private healthcare setup cannot function properly without being on board with any kind of insurance company. If if they treat two or three kind of people who are insured with different companies, then they have to be insured, they have to be on board in those insurance companies. So most of the direct care settings cannot work without healthcare budgeters approval. So healthcare budgeters play a very important role in what kind of treatment any patient can get from any healthcare facility. Then we talk about life sciences. So life sciences are the sciences or sectors which do not directly deal with the patient, but what they do does. Like any pharmaceutical company does not directly deal with the patient. They deal with healthcare professionals, and then healthcare professionals deal with patients. Just like that, biomedical equipment manufacturers, anesthesia machines, or the list is long. You can talk about endoscopy instruments, arthroscopy instruments, any other kind of surgical devices, even masks, syringes, or whatever you talk about, even gloves, everything. The biomedical equipment manufacturers and pharmaceutical companies, they do not directly deal with patients. But whatever they do is affecting the end level consumer, that is patient. Whatever they are making, whatever they are developing, whatever they're providing in the market, that has to do with the patient. That is the product which is created for the patient. Although pharmaceutical company does not directly deal with the patients, but their drugs, their medicine, which they are producing, has to be used by a healthcare professional to treat the patient. So these life sciences are also segment of healthcare industry and very important segment of healthcare industry. Many many Fortune 500 companies have in their list many big pharmaceutical companies as well, such as Sanofi, such as Pfizer, such as AstraZeneca, Abbott. All of these pharmaceutical companies have multinational appearance, and they provide and they make drugs in many parts of the world, and their dealing with the healthcare professionals has shaped the healthcare sector a lot. Just like that, biomedical equipment manufacturer, just like General Electric in United States of America, and many other companies of the Europe as well. They are the backbone of the hospital infrastructures. Many of the baby warmers in baby nurseries, many of the anesthesia machines, many of the ventilators, and many of other high-end high-tech equipment such as MRI machines, such as CT scans, all of these are made by biomedical equipment manufacturers. Now, these biomedical equipment manufacturers make these things to be used by healthcare professionals, and then healthcare professionals are dealing directly with the patient. But all of these things which are made by biomedical equipment manufacturer, for example, we talked about General Electric, all of these things are aimed towards the needs of the patient. They're not made for the use of healthcare professionals to have some kind of a game, but they are making everything for the needs of the patient. They are making new models every 2 or 3 years. They are making advancement in the previous model. They are making new machines. They are making this. They are making that, just for the sake of the patient. So all of these biomedical equipment manufacturers are also a part of our healthcare industry. And then biotechnology companies, which are doing the most important work, that is drug research. And also just like we saw in COVID, so many of the biotechnology companies also did tremendous job in doing research during the COVID-19 era. So they helped a lot. All of the pharmaceutical companies work in tandem, work side to side with many of the biotechnology companies to create vaccines at a faster rate, to create vaccine at a rapid rate, to make them available for the masses to be injected with. So biotechnology companies also take part in healthcare industry. And then there is one more important sector of our healthcare industry, and that sector is diagnostics and lab sciences. So all of these segments are very lucrative segments. All of these segments are very high paid segments. All of these segments have very high job growth. So any of you people, if you want to pursue your career in medicine or related to medicine, yeah, I know everybody wants to become a doctor, but still, if you can't become a doctor due to your financial issues, due to your marks or your scores not coming at par to the level of becoming a doctor, you can still pursue your career in healthcare industry as a whole, by starting your career in these segments. And they are very, very good segments. These are very, very rewarding segments, along with the dealing with the patient. Yeah, dealing with the patient, me being a surgeon, I know dealing with the patient is the epitome of healthcare sector. When you treat a patient and when the patient gets okay, for me being an orthopedic surgeon, I usually deal trauma all the time. Young boys uh, doing one wheeling at the with bikes and just falling every day and night on the roads, and just coming with cracked skulls, coming with cracked bones. And when you heal them, when their bones get healed and they start walking within 3 or 4 months or things like that, and then they come to thank you, you forget about all the monetary benefits of everything. When the patient comes to you in healthy state, and then you remember the state of the patient when you first saw the patient in trauma room, that is the most rewarding thing. We also had to I had to do my general surgery rotations, so we had to do with a lot of firearms, a lot of stab wounds. So when you save a patient's life and then their family comes to you and pays their regard and pays their thanks, that is some other kind of reward. You cannot talk about that kind of reward in monetary sense. That is some other kind of thing. So I'm just diverting away from my topic because that is also a very good topic to talk about. So let's focus on our topic. So if you can become a doctor, you can also, but you want to pursue your career in healthcare industry as a whole, then you can pursue your career in these segments as well. And these are very rewarding segments and very lucrative segments. And you can also work for the benefit of the humanity by giving your 100% in these segments. If you are doing some lab work and you're doing this very honestly, and you're inventing some new machine or some new method to perform a test very efficiently, very cost effectively, then that is also a very great service to humanity. Though you are performing tests, you're not directly dealing with the patient. You're just performing tests on stool, on urine, on blood cultures and things like that. But still, you're also playing a very vital role. Whatever you provide to the doctor, it will help in making the decision about the patient. So the patient's treatment depends upon what you provide to the healthcare professionals. So diagnostics and lab sciences, laboratories performing all kinds of hematological tests and body fluid analysis to diagnose various kind of illnesses. That is a very important thing. And then medical imaging devices used to peek into different body parts through non-invasive tests performed by complex biomedical machines such as MRIs. That is also a very, very good market, a very good field to enter with. So if you become a radiology technician, if you become a radiology technologist, if you know how to run an MRI machine, if you know how to run a PET CT scan, that is also a very privileged position. So you are directly dealing with healthcare professionals. You are directly dealing with the patients. So these are also very good trades. If you can't become straightforward, if you can't become doctors, you can become many other things which are almost as good as becoming a doctor. Then we will just briefly touch the topic of what is the difference between healthcare provider sector and pharma sector and other allied sectors. So healthcare, I will try to make this easy by giving some examples. So healthcare provider sector means it involves hospitals and clinics, medical research and clinical trials, telemedicine, health tourism, etc. When you are directly dealing with the patient, that is healthcare provider sector. And pharma sector, what is pharma sector? Includes pharmaceuticals, medicines, and biochemical products. Their production, distribution, regulation, all is done by pharma industry. So whenever you are dealing with the medicine alone, not the patient, you are dealing with the medicine alone, that comes under the umbrella of pharma sector. For example, if a patient comes to a hospital and gets an appointment of specific doctor, for example, he has stomach ache, a tummy ache, he goes to a gastroenterologist. Gastroenterologist is a doctor who deals with the diseases of gut, who deals with the diseases of stomach and intestine, etc. So he goes to a gastroenterologist, he gets his checkup, and the doctor advises his treatment and writes a prescription. And that patient takes that prescription and goes to the chemist. And that chemist gets those medicines from a wholesaler, and wholesaler gets those medicines from a large distribution company, which has an agreement with the manufacturer to distribute all of its medicines. So whenever any patient leaves the doctor's room with a prescription in hand, that patient has come into the lab of pharma sector. So whenever you check a patient, you advise treatment of the patient and you give him any prescription, and the patient goes to a chemist, then that patient has gone directly from healthcare provider sector to the pharma sector. That is one example. Similarly, when you talk about allied healthcare sectors, so just like differences between healthcare provider sectors and pharma sectors were explained with an example. So if a surgery has to be performed on a patient by a surgeon and his team, all of the surgical equipment needed for the surgery will be provided by a biomedical engineering company. A surgeon cannot cut open a patient, without surgical instruments. He needs a scissors, he needs a blade, he needs blade carrying handle, he needs many kinds of forceps, he needs curved artery forceps, he needs straight forceps, he needs some kind of blades, he needs many kinds of sutures, and the list goes on. So just to give an example, if a surgeon has to perform a surgery along with his team, all of the surgical equipment needed for the surgery will be provided by a biomedical engineering company. For example, anesthesia machine, surgical gloves, syringes, drapes, whatever is needed, that will be provided by biomedical engineering companies. So surgeon has to perform a surgery. He has the skill, he has studied everything, he has done his work, but he can't do anything with his bare hands. He needs another sector to play a role, and that sector is biomedical engineering company. Likewise, all of the routine blood tests to be performed prior to surgery will be done by medical laboratories working in tandem with operating surgeons and his team. We, being surgeons, do not do elective surgeries. We do perform emergency surgeries in many of the cases. For example, if a person comes with a firearm injury and we know that there might be an internal bleeding vessel, then we can't wait for the test. We just get his emergency blood CP performed and we rush the patient to the operation table within 10 minutes or 5 minutes of arriving. As we know, we don't have time. So that emergency surgery is something else. But if we are performing an elective procedure, a very thoughtful procedure, a very planned procedure, then we perform tons of tests. For example, if a patient is diabetic, we go for his HbA1c, and if a person is hypertensive, we keep checking his BP before the surgery. We keep checking his BSR, blood sugar, random blood sugars before the test. We perform echocardiography of the patient's heart so that we do know the condition of the heart. We perform ECG and many other tests or tailor-made to the needs of the patient, and all of these tests are advised by the surgeon. If a surgeon has to operate, then he has the privilege to advise any kind of test that may play a role in the post-operative prognosis of the patient. So who will work with the surgeon to decide whether that patient is operable or not operable, whether that patient is fit for surgery or not fit for surgery? There comes the role of medical laboratories. So they will perform all kinds of tests and needed by the surgeon to decide whether the patient can undergo that kind of surgery which the surgeon is planning or not. So a surgeon's decision is governed by what the lab shows. So basically, he will make his clinical judgment as well. Sometimes we do not solely believe on what the lab shows. We also take clinical judgments as well, but most of the time we do take notice that patient's HB is low, patient needs transfusion of blood before undergoing surgery. Already patient is pale. So if we give him another stress of surgery, patient will not come out of the stress of the surgery due to severe anemia. So we do take notice of all of the blood tests performed. So all of these sectors are working in tandem with doctors in providing optimum care to the patients. So basically, all of the talk is that all of these healthcare, allied healthcare sectors of the healthcare industry are working in tandem to provide the best possible care to the patient. Then we come to the second part of our presentation, and that is healthcare management. We already had discussed this topic in one of our classes previously, but as this topic is very, very important, so we decided to touch this topic again once and for all. So we will talk about importance of healthcare management first. As the healthcare sector deals with ailing humanity and provides life-saving goods and services, therefore effective management and good leadership are vital for this sector. Healthcare sector provides services and products which reduce sufferings of the people, treat illnesses, and potentially save their lives. Thus, effective leadership becomes even more necessary for ensuring that every task is done correctly and that everyone stays safe and healthy. Although managers are needed or in every sector, but the role of the manager becomes enhanced. The role of the manager becomes even more important in healthcare sector, as this sector is not some other random consumer-led sector, as we are not just selling baby toys, we're not just selling some dart guns, or we're not just selling bicycles or things like that. We are dealing with the ailing humanity. So our sector is very sacred. Our job is very sacred. Our duty is very sacred. So the regulation, so the importance of good management becomes even more when we talk about healthcare sector management. So emerging role of healthcare management in modern day healthcare industry and its domains. Healthcare management has become essential for smooth and efficient service delivery in health sector in this era. Following are some examples of how healthcare managers play a pivotal role in modern day healthcare sector. Planning. Number one, planning, directing, and coordinating various activities in healthcare. Budgeting and financial management of the entire organization. All the healthcare managers are not the ones directly doing financial management, but they are overseeing the accountants who are doing the financial management and budgeting of the entire organization. So they have to oversee all of these things. Just and rationalized work schedules for all of the staff. So if a person is at the top or senior most management position, so he has to see whether all of the staff are doing rationalized works, are undergoing rationalized work rosters or not. So there is he or she has to see whether there is any kind of favoritism or not. Number four, planning and organizing the demand for workforce and directing job interviews for hiring new staff. Then, supervision of all the departments working in an organization. Number 6, maintaining patient satisfaction through formation of an elaborate feedback system for all of service delivery areas. So he has to collect the feedback of the patient who got treated by all of the departments in an organization he's overseeing. He has to take feedback, positive or negative. He has to take that in open heart with the aim of providing better healthcare services in the future. He has to supervise all the departments. He has to plan and organize the demand for workforce. He has to oversee how many people are needed in this department and how many people are needed in that department. Whether we are having some excess workforce or we are short of workers in that department. So he has to oversee all of these things. Then ensuring regulatory compliance and liaison with stakeholders. So he has to keep happy all of the regulatory authorities. He has to keep happy the government. He has to keep happy the insurance companies and other stakeholders such as politicians of those areas, member of parliaments, and many other bureaucratic officials as well. So domains of healthcare management, and there are some external domains and there are some internal domains. External domains are community or demographics need, licensure of the organization, accreditation of the organization's departments, then regulations, stakeholder demands, such as the community leaders of the area want some nephrology department or dialysis unit. If community leaders of the area want a dialysis unit to be set up in the organization, whether that is feasible or not. So he has to fulfill the demands of all of the stakeholders of the community in which healthcare organization is to keep the people happy. So if there, for example, an area A has a healthcare organization and the people's needs are dialysis machines, they want a dialysis unit to be functional, then he has to look for many ways to establish a dialysis unit and make it functional for fulfilling the stakeholder demands. Otherwise, people will start disapproving the organization for not fulfilling their needs. Then he has to overlook the competition. He has to have a deep look over the competition in the market. Then he has to then it's Medicare and Medicaid, as in United States of America, and managed care organizations and insurers, etc. Then internal domains are staffing, budgeting, quality improvement services, patient satisfaction, physician relations between each other, so that the doctors do not keep on fighting with each other over patients or over things. They work in tandem with each other. All of the departments work in tandem with each other. Then the financial performance of the organization should be very good. Technology acquisition should be very good. All of the newest machines should be approaching the healthcare organization, so that if they want to have an MRI, they should have an MRI. They want to have a CT scan, they should have a CT scan. They should have good quality ultrasound equipment, good quality anesthesia machines, and so on. And then new service development. For example, they do not have a surgery department in any organization, so the healthcare manager always keeps on thinking that we should have a surgery department, we should have a medicine department, we should have a pediatrics department. Pediatrics mean the department of the kids, department of the infants and children. So if there is no pediatric department in an organization, the healthcare manager should always keep on thinking that how to establish a pediatric department in this organization. I'm just giving examples. Then we will just go through all of these things very shortly because we're running out of time. So there is a general misconception regarding understanding the concept of managerial roles in healthcare setting, and this needs to change. This needs to change. While most beginning students of healthcare management tend to focus on the role of senior manager or lead administrator of organization, it should be realized that management occurs through many others who may not have manager in their position title. So many of the people are involved in the management of any healthcare organization, but they do not know that they are healthcare managers as well. Although they are not senior management positions, but they are also managing the needs of a healthcare organization. So, for example, some of these managerial positions in a healthcare organization include supervisor, coordinator, director, among others. So, if any person is a supervisor, that is also a form of being a manager. If any person is a coordinator, that is also a management position. If a person is a director, that is also a management position. So all of these are management positions, and you become CEO or senior healthcare manager after acquiring experience of 10 or 15 years while working as a junior level supervisor, junior level coordinator, or director of a small department, then director of a large department, and things like that. These levels of managerial control are discussed in more detail in the next section, and these are just examples. If a physician is a good practicing physician, then he needs a practice manager, he needs a director of medical records who keeps records of all of the patients of his clinic or his setup or his hospital or and so on. And then he needs a supervisor for billing office as well. These are just example of managerial positions. And then there is a nursing home. You need an administrator who may be non-doctor, who may be a doctor, and who may be a non-doctor person. He needs a manager, he needs a business office for the nursing home, he needs a director for food services, he needs admissions coordinator, he needs a supervisor for environmental services. So all of these are managerial positions, and many of the people are not even doctors. They may be doctors and they may not be doctors. They may have degrees in other healthcare sector. They may have degrees related to other healthcare sector demands. They may be accountant as well. Accountancy has nothing to do with dealing with the medicine in college or in university. But if you become an accountant and you know how to run the accounts of any organization, you can fit in the healthcare sector as well. Then, for example, in hospital, chief executive officer, vice president, marketing, clinical nurse manager, director, revenue management, supervisor, maintenance, and so on. And this is our last slide. So 6 must-have qualities to become a good manager. He should be a good planner. He should be good in organizing things. He should be good in staffing. He should know how to oversee the staff. He should know which staff is needed at which place so that we get maximum output for that person. If a person is suited for place A and we put that person to place B, the person's output will decrease drastically. So we put back that person to place A, where that person was most suited for, or where that person wanted to work, where his passion lies, and we start getting most of his work. So that is the role of a good leadership, to see qualities in the people and then get most of those qualities. Then he should be controlling. He should be controlling. Yeah, people should know that we cannot disobey our senior, because if we do disobey our senior, there will be consequences, and our senior is a respected person, so we have to obey him. We have to take his orders seriously. He should be directing. He should not just keep throwing orders. He should give direction to his team members. He should be a proper team leader. He should give proper direction to the teams he's overseeing, so that people understand the logic behind his orders. You do not just throw away orders. You give logic that what I am telling, what I am asking you to do is for this reason.